Hey guys, Dr. Ruth Roberts here, the creator of the original Crock-Pet Diet. Hopefully the connection will be a little bit better today and all will be well. So first of all, I want to thank you guys for liking the Facebook page, Dr. Ruth Roberts. And we've gotten past 60,000 likes, and I cannot tell you how much I appreciate that and how much that helps us spread the word of what we're trying to do to help pets overcome disease and prevent it through nutrition, nutritional supplements and strategies, and and pure common sense. So thank you. Share the word. If you've got folks that you think would benefit from this, just pass it on. Each weekly video is pinned to the top of the Facebook page, and then we also have a YouTube channel, so you can check for previous episodes there as well. And Pepe's coming up to help us out today because he likes to be a big ham bone. So I've had a couple of questions recently about pancreatitis in the Crock-Pet Diet, and we've had several patients that, literally one dog has been on Crock-Pet in her entire life, and she is now 8 years old and then has recently developed pancreatitis. And then another dog that is 14 that had inflammatory bowel disease and has been eating Crock-Pet for 4 years. And then a couple of folks in the Crock-Pet community. So before we go there, what I want to talk with you about first is what causes pancreatitis. And it is super common, unfortunately, in Schnauzers and Yorkies, largely because they have an altered fat metabolism. So they truly have hyperlipidemia, which is a huge problem in humans. And it sometimes is diet related, but it's a genetic issue. And so high fat diets can cause it. However, many of these guys, when higher fat diets are combined with higher complex carbohydrate, i.e. high vegetable diet, high fiber diet, the issues are not so pronounced. But I've certainly had several Schnauzers in my practice where they were doing fine on a low-fat diet, and we switched to Crock-Pet. They did really well for several months, and then all of a sudden the levels of triglycerides started to climb. And so what did we do? Well, we backed the fat level down. And second, because coconut oil is higher in MCT, or modified chain triglycerides, that does tend to go straight to the bloodstream. And so switching to a different oil that is not so high in MCT, and I said modified, but it's actually medium chain triglycerides, then that seems to help reduce the issue, and it helps to bring the triglycerides and overall fat level down. The reason this is important is that in dogs it ends up creating major problems for the pancreas and predisposes to pancreatitis. So that's not fun. If your pet has ever had pancreatitis, it does happen in cats, and we think the chronic form is more common for them. Although I think that a lot of chronic sort of vomiting and just not feeling too red hot, gurgly bellies in dogs is often chronic pancreatitis, because we don't have really great, accurate diagnostic tests. It's difficult to get a diagnosis of chronic pancreatitis in particular. So there's a CPL test, which is a test specifically for pancreatic lipase, which is much, much better than just plain old lipase. But even it can be positive when the dog actually does not have pancreatitis. The other standard of diagnosis is abdominal ultrasound. And you can have a dog or a cat that has screaming, raging pancreatitis, but it appears normal that moment on ultrasound. In 2 days it may look different, and often that's what internists are doing when they've got a hospitalized patient, is going back and re-ultrasounding in a couple of days. So Schnauzers and Yorkies. So those are breeds where you'd want to be cautious about coconut oil. And in general, if you look back at the Crock-Pet Diet recipe, for those of you that have it, coconut oil is a component, but I do recommend rotating with other fats. So butter, olive oil, any of those high quality fats, pork fat, beef fat, that sort of stuff, that's all great. I typically don't use things like canola oil and things of that nature, simply because there are some issues with processing it. But you have to see where your pet is and then make the appropriate adjustments. But again, just as we recommend rotating proteins, carbohydrates, and vegetables, rotate the fat as well. Just because the immune system needs to see something different, as does the gut. So the other causes of pancreatitis are hormonal imbalance, so thyroid, hypothyroidism, and diabetes, for instance. Drugs, so prednisone had long been thought to cause pancreatitis, and what it does seem to do is increase lipase release in the intestine. So sometimes maybe it is, maybe it isn't. Azathioprine, certainly, which is a drug that's used to combat autoimmune disease. It can cause pancreatitis, as well as phenobarbital and potassium bromide, and a few others that, unless your pet has cancer, you're unlikely to have experience with. So diabetes, as I also mentioned, there is a theory now that there is an autoimmune component with the diabetes, but also that predisposes that animal to pancreatitis, which is pretty scary. The other, obesity is one of the biggest causes, and certainly for people. If you are obese, your chances of developing pancreatitis go way, way up. And that's because your pancreas is overwhelmed with trying to produce enough digestive enzymes to keep up, and sometimes ends up in this autodigestion phase, or at least that's one of the proposed mechanisms. And then oddly, reflux of the duodenal contents, so the duodenum is the first part of the small intestine after the stomach, up into the pancreatic duct. And so, as you can imagine, that would be irritating, and the pancreas gets irritated when its contents cannot get dumped out of the duct into the small intestine, because it's made all these lovely digestive enzymes and they've got nowhere to go, so they sit there and auto-digest the pancreas. And then trauma, like hit by a car, fell off something, that kind of stuff. Unfortunately, cancer is also a potential cause, although that's relatively uncommon. Most often, there's no known cause for the pancreatitis. And so if you are feeding something that is not within mainstream veterinary medicine's realm of understanding, that's often what gets blamed for it. So, and then the other big thing that's, for decades we've said, although it's coming into some discussion about whether it's an issue or not, is like a really massive meal of fat. So, for those of you that feed the birds and put out suet, your Labrador pulls the suet feeder down and eats it. That's a problem, because they've just eaten something on the order of about a cup of fat, and you can imagine that's not going to be fun for anybody. So, the old, when I finished veterinary school, Monday morning disease or garbage can gut were the proposed mechanisms for pancreatitis in pets. So the dog got into the garbage, it ate the leftover steak bone and fat and things of that nature, or the dog got into the garbage and ate God knows what. But they have vomiting and diarrhea, which were classic symptoms of pancreatitis. And interestingly enough, they're not so classic anymore. Sometimes they vomit, sometimes they don't. A real common hallmark now, regardless, is abdominal pain. And so that can sort of be difficult to diagnose until that pet is in really deep trouble. So the biology of the disease, if you will, has really changed dramatically. So those are sort of the causes of pancreatitis. As I mentioned earlier, coconut oil has been mentioned as a potential cause, but typically these, again, more common in Schnauzers and Yorkies, and then it's usually somebody that's been feeding a really whopping dose, like a couple of tablespoons a day for, say, a 50-pound dog. So if we break that down, if the caloric needs for that dog for that day is somewhere in the neighborhood of, say, 500 maybe, if the dog's fairly active, Adding 2 tablespoons of coconut oil means that you have just given that dog 240 grams of fat, or 240 calories of fat, I should say. And that's a lot to deal with. So that's almost half of that dog's daily caloric requirement on top of the fat that is already present in the food. So for dogs that are losing weight, we'll often recommend adding a little bit of oil, and often coconut oil, to each meal with a Crock-Pet diet, but that's on the order of a half to quarter to maybe 1 teaspoon per meal. And again, rotate the fats, olive oil, all of those really good healthy fats, butter, that sort of stuff. So, so I'm not sure. Is coconut oil associated with it? The literature search says probably not, although with the exception of the Schnauzers and Yorkies that are genetically predisposed to hyperlipidemia. And is the Crock-Pet diet high fat? Yes, it is. So compared to other diets, and it gets confusing when you look at the labels of foods because it's on a dry weight basis, but that gets, how do you compare dry food to canned food? There's a trick that nutritionists use, which is to put it on a 1,000 calorie as fed basis. And so that makes it easier to compare apples to apples. So if your standard low-fat diet that's used to treat pancreatitis is somewhere in the order of 20%, so that's low-fat. Beneful, just as an example, is somewhere around 30% fat. Akana is 39% fat, and then the Crock-Pet diet for dogs is about 43% fat. In cats, it's about 50% fat. So yes, it is higher in fat, but there's a lot of evidence that if you've transitioned onto a diet, your pet acclimates to what it's being fed, whether it's high fat, high carbohydrate, high protein. Is the Crock-Pet diet causing pancreatitis? Again, for certain breeds, it may. For all breeds, probably not. So if you've got a Schnauzer or a Yorkie, that's where you do want to have your dog's lab work done and make sure your veterinarian is including a triglyceride level, and make sure that that blood test sample is taken when your pet is fasted. If your pet has eaten, the numbers are all over the place, and it's hard to know what's what. So make sure that your dog has had a 12-hour fast prior to that blood draw. So that's what I know. I wish I had a more definitive answer. I'm going to be talking with the nutritionist that helped me balance the diets and get them to the point where they are satisfactory for all life stages according to AAFCO standards. Make sure we're not missing something here, but I can't say that it's causing pancreatitis. If I'm wrong, I'll tell you, because God knows I do not want to hurt any of our beloved pets, but I don't think so. I think there's some other force at play, especially since the biology of pancreatitis has changed so much. So that's what I've got today. Don't know if you guys have any questions in particular, but I'm happy to answer those. It looks like we're kind of dropping down on viewers at the moment, so I think I'll call it a day. Again, if you have questions, message me on the Facebook page, email us at support@theoriginalcrockpetdiet.com. Go to the website, there's an Ask the Vet form you can fill out that'll send us a question by email, and we do our best to get those answered as quickly as possible. So I hope you guys have a fantastic day. Again, thank you so much for helping us get this page likes up to 60,000. It helps us get noticed more easily on Facebook, and it helps get the message out that there are other options for helping your pet. So until next week, remember, your pet's best health starts in the bowl. Take good care.